Good evening. Hi, I'm Colonel Michael Greenberg, the Fort Belvoir Garrison Commander. Thank you for joining us again for this week's Facebook Live Town Hall. We appreciate the opportunity to update you on the installation's COVID-19 response plan and more importantly address any questions or concerns that you have. Again, I'm joined by Captain Cindy Judy, the Director of the Fort Belvoir Community Hospital, and other representatives of the hospital and my Garrison task force leads are also joining us today. Just to give you kind of the laydown of what we're doing, I'm going to have a couple recognitions. I'm going to turn over to Captain Judy. She's going to talk some hospital updates. I'm going to come back and actually talk about CDC's and transition phased approach plan of reopening Fort Belvoir. And then at the end, we will do questions and answers, and subject matter experts will answer those. So first, I want to wish Captain Judy and all of the Fort Belvoir nurses, military and civilian, a happy Nurses Week. Nurses are the backbone of healthcare, advocates for patient care, and critical to helping our forces maintain readiness. I would not be able to accomplish my mission of ensuring the safety and health of our Fort Belvoir community without the team of nurses and others at the hospital. So thank you for that.
Thanks, sir.
This week is also Public Service Recognition Week, acknowledging your dedication to civil service and willingness to serve your fellow Americans and others around the world. I want to personally thank my Garrison team, our staff, for the tremendous efforts during these last few months under very trying times and circumstances. Every directorate has risen to the challenge with the can-do spirit on behalf of the mission partners, service members, families, retirees, and visitors. Thank you so much. You've made this place a great place to live and work. We also posted in our Fort Belvoir Eagle a dedicated page A6 to that recognition. And then the last is today was the National Day of Prayer, an observance that dates back to the American Revolution and George Washington. I want to take a moment to thank Brigadier General Bill Green, the U.S. Army Deputy Chief of Chaplains, for serving as the keynote speaker in today's morning ceremony. Also, I want to thank the Fort Belvoir Chaplain, Colonel Bob Hart, and his outstanding religious support office team for hosting and producing that observance. Chaplain Hart and his team have overcome the challenges that the current COVID-19 medical emergency has presented, and they've endeavored to continue to provide the many services to the Fort Belvoir community. If you haven't seen on Sundays and Fridays for his services, we are doing those virtual, and those have been a tremendous success. Today's virtual observance and the use of technology is one example of how we have provided those spiritual support across the installation as we fight and defeat this virus. If you missed this observance, I encourage you to visit the RSO Facebook site, and we will post that address online. And so with that, I'm going to turn it over to Captain Judy.
Hey, thanks, sir. I want to start off by not only acknowledging the nurses, but I just wanted to say that it's pretty special that Nurses Week and Teacher Appreciation Week are at the same time. Extraordinary times call for extraordinary people, and this pandemic has really highlighted the importance of our nation's teachers and nurses. Both groups have gone above and beyond to meet the mission of caring for our community. I'm so proud of their innovation, their expertise, and their commitment. So the Fort Belvoir Community Hospital nurses wanted to wish all of our community's teachers a happy Teacher Appreciation Week as well. And they wanted to say that without teachers, there wouldn't be nurses. So thank you for inspiring our children. I've come to bring something every week that I wanted to show. So here's this week's picture of all of our nurses, or some of our nurses, honoring the teachers of our community. So thanks. I also just wanted to remind everyone that Mother's Day is this week. So remember your mothers out there, especially those of you who are far from your mothers and feeling some of that isolation. It's a hard time for some families, and so make sure that you call your mother. So. The main update that I wanted to give today really is about elective surgery, because that seems to be all the talk at the hospital right now. So how are we going to bring back elective surgery? The one thing I wanted to share about that is we never really stopped doing surgery at the hospital. What we were doing though, was we were doing urgent, emergent, and time-sensitive surgeries where if a patient had to wait throughout this pandemic, it could have jeopardized their health further. And so as this pandemic began, we had a number of patients who didn't fall into that category that we really had to defer their surgery until another time. And so there's somewhat of a backlog. And what we've done is we've taken that list of patients now, and the surgeons have prioritized them based on their acuity or their severity. And they've already begun reaching out to some of those patients so that they can start scheduling their surgeries and performing those. Some of that is going to happen as early as next week, okay? So if you're somebody who was already scheduled or the surgeon had identified but you weren't yet on the schedule, know that the team is reaching out to you and you have not been forgotten. We also don't want anybody who's fallen ill over this time to think that they have like back of the line privileges. And so as they have new consults that come in, when somebody sees their primary care manager and it's identified that they need to consult with a certain surgical specialty, they'll start to take a look at those new consults coming in. And so for a period of time, we're going to balance that backlog of cases that were deferred with any new cases coming in to make sure that we're seeing patients as quickly as possible and as safely as possible. One of the things that I want to bring up, though, is that as we start to slowly bring back more patients in the hospital, we need to continue all of those public health initiatives that we've done to protect everyone. And so the cloth face covering will still be required. I need folks, just like you said, at the commissary, at the PX, and throughout the base, as you come, if you find yourself in a waiting area for a brief period of time, that social distancing within those waiting areas, we're certainly going to put some signs up and remove some chairs in some areas so that we can help remind people. But we're all in this together, and we want people to observe all of those recommendations that have been ongoing in other areas throughout the base as well as at the hospital during this time. But as we start to increase the volume of patients at the hospital, we want to be mindful of that. Right now, the parking remains in the front of the hospital. We don't have a plan yet to open the garage because there's been enough parking in front of the hospital to accommodate all of the patients as they come. But we will continue to monitor that and then open the garage as necessary. The curbside pharmacy has been incredibly popular during this time. So thanks to the team for doing that, but thanks for the patients that are giving us that feedback and helping us to tailor that service. That's a plane we built while we were flying it. I hate that phrase, but it seems relevant, right? And so we continue to tailor that service. But the single greatest thing that you can do to save yourself a trip in that curbside pharmacy is to activate your prescription in advance. So we continue to encourage folks to do that. Those are the big updates, really, for the hospital for this week. So I'll give it back to you.
Great, thank you. So last week we talked about CDC availability and PCS moves. So I'm going to start with an update there. If you remember last week, I talked about the family child care providers, the FCC providers. This program allows families to use their home as a daycare center to assist Fort Belvoir families. We have some availability right now on those homes, but due to the limited availability in our child development centers, we're trying to recruit individuals who live on the base to become a licensed family child care provider. We invite any military spouse living on Fort Belvoir to become this child care provider. The FCC provides excellent training opportunities, managing your own business and becoming part of a great team. So if you have questions about becoming a provider, please contact Family Child Care Office at 703-805-1824, and we'll post that number online as well. There's been a couple questions. I'm going to let Mr. Dixon address the technicalities at the end when we do questions and answers. But there's been questions about, if I don't have availability, can I go use Army Fee Assistance Program? The answer is yes. He'll walk you through how to do that. But again, the takeaway there is we are not going to go up to full capacity, even in the next couple months. And so we owe it to you. We've already sent a note out to parents as well, indicating that we will have limitations with the social distancing rules, that our capacities will be cut significantly. And so more to follow on there, but again, that's one that we want to continue to put out to the community, that if you're expecting to use the child development centers in the next couple weeks for you're going back to your job, you need to reach out. If there's no availability, then you need to find alternate care for your children. For PCS orders, again, the stop move is in effect till June 30th. If you have questions, there's an Army-wide free number to contact Army Human Resources Command. And it's available 24/7. The number is 800-582-5552. If we can post that on the site as well, I'd appreciate that. So before I talk about the transition plan, the reopening plan, first I want to thank the community for being patient with us and being patient with yourselves. It takes a lot of patience to isolate in your house and to stay at home. I understand that. It takes a lot of patience to be able to put face coverings on and to social distance. It takes a lot of patience to be inconvenienced at the gates when it's taken a little bit longer to get through the gates than it had when we were at our normal capacities. Or to go to one of 3 gates that are open when you're used to 7 gates open. I understand that. And again, I appreciate your patience as we work through this pandemic. But again, everything that we're doing on the installation is to protect the community. And so as we are opening up and reopening up Belvoir, the number one priority is making sure we open it up and we're protecting the community at large. And so you may hear about the state or the county opening up activities. We may delay a couple of days or a couple of weeks before we open up the Fort Belvoir activities. There may be some that are actually on the same timeline as the county as well. But I want you to know, before we open up any activities on this installation, we're going through risk assessments. We're looking at each of the activities, and we're making sure, one, they have PPE on hand. 2, we're practicing all the guidelines that are put out there with social distancing. And so as you see services open, it may not be what you're used to. It may not have the full capacity that it had in the past. But no, the number one priority is to protect our workforce and to protect our community at large. So I appreciate also people taking the poll on for this town hall on your top 3, what's most important. So gyms, playgrounds, and CYS were the 3 services that you thought were pretty important to folks. So I appreciate your feedback on that. Even though it may not be possible to open everything right away, I still think it's important to understand what your insight is, where you think what you think is important, and just know we need to work through this together. And so I'm going to post. It looks like this. We will post this out on our website here in the next 12 to 24 hours. And it's the reopening plan, the reopening Belvoir plan. I want to take the opportunity today to talk about it prior to releasing it out to the community at large. And so this is a recovery framework. And so when I say framework, it gives us our left and right limits. It tells us generally when we're going to open up in phases, and it provides some direction. A lot of the information at the upper portion of this chart was taken from the White House Task Force guidelines on reopening America. And so basically it is a conditions-based, risk-informed decision matrix that we're using as we're opening up each of the activities across the installation. Some of the conditions that influence that decision, really the suspension of the bans, stay-at-home orders, emergency declarations, all those have play in what health protection condition that we're in or what we're going to. Also, the downward trending of case counts and hospitalizations throughout the NCR over a 14-day period. And so we are doing trend analysis, and I say we, it's not necessarily Fort Belvoir, but it's the National Capital Region, it's DHA, it's the hospital, it's the state. And so all those are contributing factors to looking at when we would reduce down our health protection conditions, which we're at Charlie right now, But as we reduce down health protection conditions, additional activities open. We also need to look at the hospital's capacity to screen, test, and treat, the availability of robust testing throughout the NCR, and then our ability to sustain adequate levels of staffing, personal protective equipment, and cleaning supplies. These have all been put out in the Opening Up America plan established by the White House Task Force. Those are things that we are looking at as we open up activities. I have a note in there that says, as conditions evolve, the framework may change. Again, I want that's important. We're putting out a framework. We'll put an as of date on this before we send it out. But just know that this potentially could change as conditions transpire. The plan is broken into 4 phases. You have HPCon Charlie, which is the phase we're at right now, HPCon Bravo Alpha, and then HPCon Zero. Just so you know, what we're considering the new norm is HPCon Alpha. Okay, we got to understand that we're not going to go back to a normal for many, many months. I'm not going to put timelines on there, but again, when you look at the plan, you'll notice there's no timelines or dates associated with the plan. It's all conditions based. So in HPCon Charlie, which is where we are right now, we have strict physical distancing and face coverings. Throughout the plan on Charlie, Bravo, and Alpha, we do not see face coverings leaving the situation. Again, face coverings and distance is the best proven strategy we have right now to fight the virus. Because remember, not everyone is symptomatic, and so you may think you feel fine, but if you're not wearing a face covering and you sneeze or you cough, you're by someone, you're in an area, and you release the germ onto a surface. It stays on the surface. That's how an outbreak starts. And so again, the strict face cover, physical distancing in Charlie measures, it's 10 people in a room. Okay, as we expand out to HPCon Bravo, we're using 50 as the grouping of any type of event. And then when we get to HPCon Alpha, we expand out to 100. Okay, and again, we think 100 is going to be kind of where we're going to be at 0 when a vaccine is available, and we go to normal. Then we will not have restrictions on gatherings or the face coverings. So in Charlie, many of our services and activities are closed or modified and very, very restricted. As we move to Bravo, some of the services and activities will be reopened in limited access. And then in Alpha, of course, more services will be open, more activities, and more access. So I'm going to break it down just a couple big categories. So food. So as you know right now, food is grab and go only. We see grab and go staying for the next phase for HPCon Charlie and Bravo. As we move to Alpha, we will start seeing limited seating indoors. But again, it's going to be limited seating. So you may have already seen the preparations at the food court, or you may not have. I'm not sure if we've actually implemented, but you'll see tables start to disappear. And more limited access with farther distances apart. So as we open up those facilities, you'll see seating more far apart, and that's no different than what you would see outside the gates as the outside the gates open up. For the commissary and PX, so we see curbside. The curbside through HPCon Bravo will assess, and it may go away in HPCon Alpha. The delivery. We see the deliveries at least through HPCon Bravo and then going away. And we see the enhanced screening, the temperature readings, and the questioning at least through HPCon Bravo. But again, I think our commissary and PXs are doing very well. They're open we have some limited hours in the AFEs, but not a lot, just by a couple hours. We may see that expand out when we get to HPCon Alpha. Childcare. So childcare is pretty big right now. Okay, right now we have about 30 children in care. They're all vital employees that are working right now that absolutely have to be at work. As we get to Bravo, essential personnel, and in our child development or child development staff, children, and then we expand out in Alpha to more capacity, and then we expand out to our single and dual military. That's where it stands right now. Please keep in mind with social distancing, we're limited to the number of children that we have in each of the classrooms. And we're limited by the ratios that we have to maintain as well with our CDC or CYS employees. And so again, as we go farther along, we know that the capacity is going to be limited, but we will continue to try to push to allow as many folks as we could get in there, providing safe care to the children and providing an environment that's safe to our CYPAs and our CYS staff. Recreation. So for golf courses, that's so for the county is opening up on Friday. Their golf courses here in Fairfax County. Golf is a pretty low risk when you manage it correctly, and so our golf course will be one of the first things opening, and it could be an HP Con Charlie. So you'll see it on here, conditions based. Nothing will open before next town hall, so I will announce it if we have a date in mind. But again, we continue to assess as we go further along. The next thing that will open potentially is some of our outdoor activities, our playgrounds, our fitness centers. Again, I know fitness centers are up high on the list, but again, once the conditions are set that we can open it up, we have already assessed. We have a plan of attack. I'll present that plan of attack next week, but we know what we need to do when the time is right to open it, and then we will communicate that out to you. Not to leave you in any anxiety, since I have it, I'll be transparent. Okay, so what we're looking at right now is an hour-and-a-half time spots, limited one session per person for then a 30-minute cleaning, and that would be limited starting out to service members and potentially some of our first responders that require that for their jobs. And then as we see the capacities, who's using it, and how we can continue to maintain safety, we will expand that out to a longer period of time and to a more of a population. But again, for expectation management and transparency, I'm putting it out there right now on what it will look like at Fort Belvoir. Our indoor pools and outdoor pools, we are preparing those to open this summer. Again, conditions based. Once the conditions are right, we have all the safety precautions in place. Again, the pool of what you experienced last year is going to be a different pool than what you experienced this year. It'll be open, but there'll be limitations. We're looking at a morning session and an afternoon session for pools with some time to clean. And again, working the social distancing and how the face coverings play into the pool. Again, a little bit more difficult considering it'd be unreasonable to ask you to tan with face coverings on. I think people would look a little bit not normal. So more to follow on that one. Our bowling we're looking at as well. That will be opened up. It's a little bit more of a high risk activity that will be opened up later in HP Con Bravo or in Alpha. For some of our other popular services, the barber shops. Okay, right now the barber shops are closed. They've opened up in Maryland. They're potentially opening up next Friday in Virginia. This is one that may open up pretty close to when the community opens up. And the reason being is, one, I understand the demand for haircuts, especially in those who are in service wearing the uniform, as our jobs really dictates that we get it. And so for barber shops, again, we're working through the procedures. It's not going to be the normal. Okay, so we will do barber shops by appointment. Starting out, there'll be extreme social distancing. PPE will be worn. Face coverings will be worn during it. We've implemented several other measures. We are going to ask for name, phone number, and email, just in the case that a barber comes up positive, that we have a list of people that we can reach out to, and that would be the hospital reaching out to them as they trace, or the state or the county hospital reaching out to them as they trace that positive COVID case. And so, Again, it's important in the sense that, again, barber shops are not extremely high, but they are relatively high unless you have measures in place. And so we're going to make sure that we are strict on our measures and making sure we're doing it right. And so we will open it up. It'll be starting out again to active duty in uniform, starting out in corrections service members in uniform, starting out for the first couple of days or week. And then as we catch up and the barbers have more appointments available, then we will expand out to the rest of the community. So again, that's how we're rolling out the barber shops. The banks, drive-thrus will continue on. We'll expand out to lobby services, probably in the HPCon Bravo. Our ID cards, VA services are virtual right now. You'll see those expanding out. Playgrounds, I know are question marks. There's been a question, when are the playgrounds opening up? When are the outdoor activities open up? When the marinas open up? As soon as I know a date, I will tell you a date. But what we're doing now is we're working closely with the hospital, who's working closely with the CDC guidelines, with the state and local officials to figure out what the standards are to maintain those outdoor activities. And then before I open up the outdoor activities, I want to make sure that a standard is adhered to. And so if we can't adhere to the standard because we don't have the resources, or it's unreasonable to maintain that standard, then we're going to delay opening those activities until we can get the standards met. But again, as we're opening up Fort Belvoir, the number one priority is the safety of our families, of our service members, and of our workforce. And so those will all be into play. Our religious services, we've done very well with our virtual religious services. Those will expand out for some time. In HPCon Alpha, we will look at potentially doing some limited services and some limited activities. However, remember that some of our services have 400 to 600 people in them, and some of the community is also high risk. And so again, balancing between what a service brings versus virtual brings, and how we can bring that to the community is what we're working on right now. So again, I want to just highlight again, this is not a time-based approach. You will see no times in anything that we document out here. Everything will be conditions-based. It'll really be starting with the HPCon Charlie to HPCon Bravo level. Again, that will be conditions-based, and the decision will be made by Major General Jones, the MDW and Joint Task Force NCR commander. Once he makes that decision, also our public health emergencies is still in effect, and we will look at potentially extending that out. It runs out in the middle of May. Okay, so that was a huge update. Let me see if I have anything else. Okay, we're gonna start with some of the questions, and if I can get, ma'am, do you have a question? Any other questions?
So a question just came in. Can staff still pick up refills at Fort Belvoir Community Hospital? Are they required to use the drive-through? And the answer is that they're still the staff process is still the same staff process. If they activate their prescription in advance, they can still pick it up in-house at the window since they're already in the building. I did want to say a couple of things about what you just talked about. You know, one of the things that you mentioned in your recovery plan was that widespread testing. There's a difference in testing for patient care, right? Diagnostic and treatment-related testing, and testing for mission. And one of the things that's happened in the Department of Defense is that the DHA has appointed Major General Payne, who's DHA's Assistant Director for Combat Support, to what's called a testing task force. And so all of those requests, the Secretary put out tiers for what those testing requirements are and those priorities. And so we've already begun some of that tiered level testing, but I know that there are a lot of commands out there that are wondering about testing prior to certain missions and so on. And so the DHA has implemented a task force to take a look at that, and Major General Payne is the lead on that. So.
Okay, great. Thank you. All right, I'm going to bring Mr. Henschel up to talk installation access. As he's coming up, I want to address a couple questions. And so first, there was a question, what's being done to crack down on people running food businesses out of their homes, especially since we are in the middle of a pandemic? So first, you should not be running a food business out of your home. Again, I would, unless it's authorized, which again I am not tracking, that are any of them are authorized for serving food out of your home. So again, if you see something, say something. If that doesn't work, please report that to Department of Emergency Services or the Garrison Public Affairs, and we will get it in the right channels, and we will make sure we enforce the regulation and rules that we have on the installation. Question came up, are you providing your soldiers with PPE? And so the question is, there's face coverings coming in. We were fortunate, the services were fortunate, there was a large donor for face coverings. We have a whole lot coming in. The plan right now is to issue out 2 face coverings per soldier, and then looking at service members as well. And so that plan is oncoming, or it's coming out soon, and should be in place here in the next couple weeks. And then the last question, I think from the command group, if I look at these groupings, the White House is currently having a briefing and discuss ways of the transmission of the virus is impeded. With White House discussions like this and opening up outdoor activities, what is the plan for basketball courts, skate park, and the playgrounds on the post as the weather warms up? And the answer is, again, I'm not going to give you a time. It's going to be conditions based. I would tell you, I have a public health emergency officer, Colonel Stubbs or Dr. Stubbs, who gives me advice daily. I also have Captain Judy that gives me advice. But again, all these rollout plans and everything we're doing is based in conjunction with the hospital and with all the guidelines out there. And so the White House is putting out guidelines to the community. We are dialoguing between the hospital, my public health emergency officer, and my staff to make sure that we're doing everything in precautionary measures to make sure that we're protecting the force. Do you have anything that you want to add on
No,
that?
I think it's important to point out that there's the information, and we use the White House guidance that comes out, but there's the state guidance that comes out too. So there's a lot that we have to make sure that we're in alignment with before we just say we're going to open something. But I think that your discussion of the recovery plan was excellent and kind of giving us an idea of what we can anticipate. I think most importantly, I think people need to recognize that the virus is still out there. Even though the weather is getting better, the virus is still out there. And so all of those public health measures that have been put in place are really to protect everyone from those. And so balancing some of what's going on and the risk, right, is very important. So as you see things start to open up, you're right, it's going to be a new normal. It's not going to look like it did in the past, and so I don't know how long that will go on, but our new normal is going to be very different. But there'll be some things that are really positive, right? So there are things that, like, for example, that we've done at the hospital that patients really love. Virtual health is one of those things that we really had to put an infrastructure in place. That was one of the questions that actually came up on the Fort Belvoir Community Hospital page. Are we going to start using Zoom for patient care? We can't use Zoom on a DoD computer, but we're using other programs, and we're doing the same thing that Zoom does with patients. And so I think the new normal for us is going to be that you're going to see some opportunities to get care at the hospital in a different manner. So not all is bad with the new normal.
Okay, great. And then before Frank comes up, I just want to address one of those in his category is block parties in villages of Belvoir. And so it came up last week. I'm not sure I addressed it last week. I'll address it this week. So again, we got to be safe. We're in it for everyone. So think about a block party. If you're thinking about a block party, just remember you're cross-pollinating food. You're also going to not maintain your social distancing. So again, if there's a block party going on, it's not advocated. I don't have a policy letter that says no block parties. If I need to do one because we start having block parties, I can do that. Again, I can talk with the lawyers and find some authorities to do that. I'm asking the community at large, block parties, you need to be smart. Maybe do a virtual party where all the neighbors can come on some virtual site and you do a party virtually. But again, we really need to make sure that we're smart. If you're cooking food in your house, you really don't need to share it. You don't know. Again, you could be asymptomatic and don't know that you have the virus. And so, again, please use common sense as we go forward and we start relaxing some of the items and opening up activities. We still need to be cognizant that you may feel fine, but you still may be a carrier and be positive and not know it. And you can transpose that to someone who's a high risk or someone who's not fine. And again, that person could then transmit it, and that's how an outbreak occurs. So again, please be smart.
Thank you, sir. Sir, I'd like to start, if I could, with an announcement. The Director of Emergency Services asked the Garrison Commander to consider the extension to the visitor passes, and the Garrison Commander has extended the expiration date of the installation visitor passes an additional 30 days. So now those passes will not expire till 15 June. My first question was, what is the point of scanning one person's ID card at the gate if the guard is only going to stop you and scan the passengers? The guard will make you go into reverse to scan your card, but then pull forward again. The current force protection condition for Fort Belvoir does not allow for the Trusted Traveler program. The Trusted Traveler program allows for one person in the vehicle to be the sponsor for all the vehicle occupants. The current system out there, the AIE system at the gate, is designed for one person for one vehicle. So the guard must then scan the remainder of the passengers. My second question is there a chance the guards can get hazard pay? Answer, I had our resource management office review this, and the current OPM guidance and current situation does not merit hazard pay for our guard force. Sir, that's all I have.
Okay, great. Thanks. Okay, as I'm going through a couple more, Mr. Dixon, if you can come up, be prepared to talk CYS real quickly in the procedures. A couple other questions. So, someone named one of the restaurants of employees not wearing face coverings. Please reach out to us. Ivory engaged in the one facility that someone said people were not wearing face coverings. If this happens, please continue to reach out to my staff or to me. Put a nice complaint in. Do what you need to do, and then I will reach out to the AFE's general manager and make sure that not just our patrons, but everyone is abiding by the guidelines out there. And then the second one, Army civilian shopping. Do we have clarifications for a temp authorization for civilian shopping at the PX and commissary? I would tell you there is no authorization right now for civilians to shop at the commissary or PX. And so the second question was processes. Again, because there's no authorization, there's no determination made. There could be other things going on in other installations, but from here at Fort Belvoir, again, that temporary authorization is not allowed for folks on the installation. Okay, Mr. Dixon.
Thank you, sir. 2 questions from CYS. Any information about changes in the preschool pre-K kids schedules or routines would be great to hear about ahead of time, so parents can prepare them with new normal things like wearing masks or not touching other friends, etc. Answer, yes, CYS will provide families with schedules and routines via SIMS email and Facebook notifications to assist with transition back into the programs. Question number 2. Will CYS provide statements of non-availability online or in person for children that will be removed from childcare due to low priority? We currently hold a slot in on-base childcare. When will we know that we are no longer a priority and are ineligible to resume childcare? Will that notice come with the statement of non-availability, or is it needed for the childcare aware? Answer, families unable to receive care on Fort Belvoir must go through Child Care Aware of America for Army fee assistance. They will create an account, find a provider, then the statement of non-availability will come from Child Care Aware of America for Army. CYS signs a letter verifying that child care is not available within 30 days of date care is needed. I just wanted to add a little bit more information about FCC homes on Fort Belvoir that has to do with unauthorized homes providing daycare on the installation. Army policy requires that anyone providing care on a regular basis for more than 10 hours per week must be certified through Child and Youth Services as an FCC provider. Providing unauthorized child care in government-owned leased housing puts you at risk of losing your housing privileges. Unauthorized child care by uncertified person puts your child at risk. Thank you for your time.
Thank you. If I can bring DHR up, and while he's coming up, I'm just going to address Walker Gate real quickly. So there was a question about Walker Gate. When is it opening? Is it on timeline? The answer is it's on the timeline that we had said, October-November timeframe, or correction, September-October timeframe. But again, we're still working through the permit process, which is at its final stages. Once that goes through in the next probably couple weeks, there will be huge progress. They're actually already started making the gate. The designs are all done. Everything is done. Just waiting for the permit to actually do the execution of the plan. So again, it should be September-October timeframe when that gate opens.
Good afternoon all, Kevin Rennick, Director of Human Resources. Question for today, does Fort Belvoir have an in and out processing and is it done virtually? The answer to your question is yes. All in and out processing is done virtually. I ask that you consult with your unit, S1 or organizational administrator. They are working in concert with all personnel within the Military Personnel Division and can assist all soldiers with their in and out processing procedures. Thank you.
Mr. Landgraf, do you want to come up and answer the one question on reflective road markers?
Yes, sir. The question was, will we install reflective road markers on the main driveways or the thoroughfares, Belvoir and Gunston? The answer is no. The reflective road markers unfortunately do not last as long as we would like them to. However, we are tracking this issue and we are working to restripe the roads with the highly reflective centerline markings and sideline markings that VDOT uses in order to improve visibility. Thank you.
All right, great. Any other questions out there from, no? Okay, I'm going to turn it over to Captain Judy for some final thoughts.
This has been a great forum, and I appreciate the opportunity to really talk, but to hear your updates each week. So it's good. I start to see some non-COVID related stuff trickling in, and I think that that's an important sign of what the future holds for us. So I'm optimistic. So thanks to everyone for the great questions, and just happy Mother's Day, happy Nurses Week, and happy Teachers Week.
Okay, and then my final closing remarks. So first, again, thank you to everyone who's working on the installation, who's maintaining the installation, who's coming in every day to make sure that this installation is operating even in the times of COVID. So thank you all for providing those services and everything else that you're doing here on Fort Belvoir. Thank you for the community for participating in the town hall. Like you, I think this is a great forum to communicate out. We focus on COVID, but as we go on with a couple more weeks, we're going to bring in some special guests just to give some updates, provide some announcements on some future things going on the installation as well. And so again, thank you for viewing this. Again, if you've missed out, you can recap this through the posting. You can find this on our homepage. And then also thank you for all the feedback. It makes us a better place. And so I know a lot of folks comment, and there's a lot on Facebook, some good, some bad. But again, that feedback helps us out in improving ourselves. So appreciate the feedback. And again, stay safe. Thank you for listening. We look forward to the next update. Remember, we're all in this together. The longer we stay at home and apart, the sooner we'll be all together. Again, happy Mother's Day, happy Military Spouses Day. Thank you for the teachers and the nurses. So again, have a great night. Thank you.